Welcome to the Deep Dive. Today, we're taking a fascinating journey into orthopedic pathology.
Yeah, it sounds maybe a bit technical up front.
It does. But really, it's all about understanding what happens when our bones, joints, muscles,
Hmm.
ligaments, tendons, even nerves, our whole musculoskeletal system.
Things aren't working quite right.
Exactly. And we've pulled together quite a bit of information to look at the causes, the effects, how we identify these things, and importantly, how we treat them.
Right.
Our goal really is just to give you a clear, insightful grasp of this whole area of health without, drowning in overly complex medical jargon.
Absolutely. And when you think about it, this system, it's just foundational for so much of what we do, isn't it? It's
Yeah.
not just movement. It's what lets us be active. It supports our bodies. It really profoundly influences our overall quality of life.
Yeah.
So getting a solid handle on the issues that can pop up and why they happen, that's incredibly valuable.
Okay, so let's unpack this then. Yeah. What are the sort of initial sparks? What can lead to these orthopedic disorders? What sets the stage?
Well, we see that some challenges, they can be present right from birth. Those are congenital conditions.
Okay.
Then you've got hereditary factors, things we might inherit, from our families.
Right, genetics.
Exactly. And then finally, our environment can also play a pretty significant role. How our musculoskeletal system develops, how it functions throughout our lives.
So it's often a mix, our inherent makeup and the world around us.
Pretty much, yeah, a combination.
So a blend of what we're born with and what we experience?
Yeah.
But what about problems that crop up later on?
Right. Well, direct impacts, injuries like a fall, an accident,
Mhm.
those can obviously cause immediate issues like fractures.
Sure, makes sense.
But our sources also really emphasize the gradual weakening, the loss of bone tissue over time. And this is where conditions like osteoporosis become really important.
Osteoporosis, yeah. And the impact of these disorders, it's got to be more significant than just feeling a bit sore.
Yeah. Oh, it really is. The effects can be quite broad, actually. Physically, we're talking persistent pain, bones breaking more easily.
Fractures.
Fractures, yeah. And even things like a gradual loss of height. Mobility can become limited.
Okay.
And here's a connection you might not immediately think of. In some cases, there can be an increased risk of other problems like UTIs, urinary tract infections.
Really? How so?
Well, perhaps due to reduced movement affecting bladder emptying properly, and even pneumonia, possibly linked to, shallower breathing if mobility is severely restricted.
Wow. That's a connection that really shows how interconnected everything in the body is.
It really does.
And the impact isn't just physical, is it? I mean, there must be other effects, too.
Not at all. There can be pretty significant mental and financial consequences as well.
How so?
Well, dealing with ongoing pain, reduced independence, that can certainly affect someone's psychological well-being.
Yeah, I can imagine.
It impacts their mood, how they see themselves, their self-confidence, the fear of falling, for instance, that can become a huge source of anxiety for some people.
Mhm.
And then you have the financial side, the direct costs of medical care, treatments, maybe medications, and also potential loss of income if someone can't work.
Right, the knock-on effects.
Yeah.
Let's zoom in a bit on something our sources kept highlighting, that increased likelihood of fractures as we get older. What's the main driver behind that?
Yeah, that's a big one. The primary factor is a decrease in bone mineral density. We lose minerals, particularly calcium, from our bones as we age.
Okay.
For women, menopause brings about a really significant drop in estrogen, and estrogen plays a vital role in keeping bones strong.
The hormonal link.
Exactly. Men also experience a decline in sex hormones, though it's usually more gradual, but this can still contribute to conditions like osteoporosis over time.
So it's like the scaffolding of our bones becomes a bit less dense, less strong.
That's a good way to put it, yeah.
Mhm.
Less dense, more brittle.
So it's largely that shift in hormones making our bones more susceptible.
Primarily, yes. But it's not just the bones themselves changing.
What else?
Well, our sources also point out that older individuals might be taking medications that can affect bone health. We can talk more about those later.
Okay.
Plus, their eyesight might be declining. They might have a decrease in muscle strength, less control for balance. all of which increase the chances of falls.
Ah, so it's a combination of factors increasing risk.
Exactly. It's often a confluence of these things that leads to those fractures.
Osteoporosis keeps coming up. It sounds like a really widespread concern.
It is. It's a very common condition, and it has a significant impact on how well people can live their lives, their quality of life.
Hmm.
It can unfortunately lead to a cycle of poor health, disabilities, and sadly, sometimes even death, often resulting from complications after a fall.
And the fundamental issue is just that reduction in bone mineral density.
That's the core of it, yes.
Yes.
Making the bones weaker and much more prone to breaking under stress that they could previously handle.
But it's not all doom and gloom, right? Our sources mention things we can actively do to help ourselves.
Absolutely. There's definitely positive action we can take. Exercise is crucial for maintaining bone mass.
What kind of exercise is best?
Weight-bearing activities are key things that put gentle stress on your bones, like walking, jogging, dancing. Balance exercises are also important, especially for fall prevention.
Right.
Even general aerobic exercise helps. And what's quite interesting is that rotational movements where your muscles pull on your bones in different directions, like in golf or tennis, seem to be really beneficial too.
Interesting. And diet.
Oh, absolutely. A balanced diet rich in calcium and vitamin D is vital. And of course, avoiding smoking. Smoking has a known negative impact on bone health.
Okay, good to know. So what are some of the red flags then? Some symptoms that might suggest someone is experiencing a bone disorder?
Our sources mention several key things to, watch for. Obvious changes in the shape of bones, for one.
Like a deformity.
Yes, or maybe persistent pain in the hip area. An unusual thickening or overgrowth of the skull bones could lead to headaches or even hearing issues.
Wow.
Pain or numbness in the arms or legs. That could happen if the spine is affected and nerves are being compressed. And just a general feeling of weakness, especially noticed in the hip and knee joints.
So if you're noticing any of those, it's definitely worth getting checked out by a doctor.
Absolutely. Early detection is always helpful.
And what are the main ways these disorders are actually treated once diagnosed?
Well, treatment really depends heavily on the specific condition, the severity, the patient. But our sources outline a few general approaches.
Okay.
First, you'd want to address any underlying issues that might be contributing, like are certain medications causing problems, or are there other medical conditions at play?
Right. Tackle the root cause if possible.
Exactly. Then there are medications called anti-resorptives. Think of these as, well, they slow down the process of bone breakdown.
Okay, slowing the demolition crew in the bones.
Yeah, that's a good analogy. They help slow the degradation, reduce fracture risk, and essentially help maintain or improve bone strength.
And you mentioned another type.
Yes, in some cases, anabolic therapy might be used. This is more like bringing in the construction workers. These therapies actually promote the building of new bone tissue.
Got it. Slowing breakdown versus building up.
Precisely, different strategies for different situations.
It's quite eye-opening, actually, to realize that some medications we take for other things can actually have a negative effect on our bones.
Yes, that's a really important point that came up. High levels of glucocorticoids, like cortisol, whether your body produces too much naturally or you're taking them synthetically, like prednisone.
Right, for inflammation or autoimmune conditions.
Exactly. Those can interfere with the body's ability to create new bone cells and can also speed up bone breakdown.
What other types of drugs?
Well, the sources mention certain drugs used to treat breast and prostate cancer, some anti-seizure medications, certain blood pressure meds, some heartburn drugs, and even some diuretics.
Wow, that's quite a list. Something to be aware of and discuss with your doctor, I suppose.
Definitely. It doesn't mean you should stop necessary medications, but it's about awareness and managing potential risks.
It's not just medications, right? You mentioned other health conditions can also play a role.
Correct. Certain existing medical conditions can influence bone health. Neurological disorders can impact mobility and bone density. Problems with absorbing nutrients properly, that's malabsorption, can mean you're not getting the building blocks for strong bones.
Makes sense.
Deficiencies in sex hormones, as we discussed, diabetes, chronic kidney disease, and an overactive thyroid gland, hyperthyroidism. These are all medical conditions that can increase the risk of orthopedic disorders.
Okay, that paints a clearer picture of the causes and effects. Let's shift gears a bit and delve into the different types of orthopedic disorders that our sources cover. It seems like a really wide spectrum of issues.
It is indeed. And orthopedic pathology, the study of these diseases, really helps us categorize them, which is crucial for, accurate diagnosis and understanding the root causes.
Right.
One major category we need to talk about is bone cancer and tumors.
And our sources highlighted some particularly aggressive forms, especially affecting younger people.
Yes, unfortunately. Ewing's sarcoma and osteosarcoma are noted as common and often aggressive tumors that frequently affect children and adolescents.
Where do they typically occur?
Ewing's can arise in either the bone itself or in the soft tissues right next to it. Osteosarcoma tends to develop near the ends of the long bones, like the femur or tibia, weakening them.
And there are other, maybe less common types of bone cancer too.
Absolutely. There's chondrosarcoma, which develops from cartilage-producing cells.
Mm,
These can vary quite a bit in how fast they grow and their potential to spread.
okay.
Chordoma is a relatively rare, slow-growing cancer that typically occurs along the spine from the base of the skull down to the tailbone. It has a notable chance, around 40%, of eventually spreading, often to the lungs. Any others?
Yes, undifferentiated pleomorphic sarcoma, often called UPS. This is typically a soft tissue cancer, often found in the arms or legs. Then there's fibrosarcoma, originating in the fibrous connective tissues like tendons. And one more specific one, sarcoma linked to Paget's disease.
Paget's disease.
Yes, Paget's disease is a condition where bone remodeling goes awry. In rare cases, usually in people over 70 who already have Paget's, a very aggressive sarcoma can develop within the affected bone.
That's a lot of different types of bone cancer. But beyond cancer, there are many other, perhaps more common orthopedic issues people face.
Definitely. Things like various forms of arthritis are incredibly common. Pain affecting specific areas, the back, feet, hands, knees, neck, shoulders. Osteoporosis, as we've discussed. Paget's disease itself. And numerous soft tissue injuries like sprains, strains, tendonitis.
Got it. Our sources also mention a category called non-neoplastic disorders. What exactly falls under that umbrella?
Right. Non-neoplastic simply means not caused by abnormal growths, so not cancerous.
This category includes things like genetic diseases that affect the musculoskeletal system from birth. Osteoporosis fits here too. Bone infections, called osteomyelitis. And Paget's disease again. So these are problems with the bone or its structure or metabolism, but not due to uncontrolled cell growth like cancer.
That clarifies things. Then we have conditions that affect our ability to move in different ways. You mentioned neuromotor impairments and degenerative diseases earlier.
Correct. Neuromotor impairments are conditions that are present at or maybe just before birth, affecting the brain, spinal cord, or the nervous system's control over muscles.
How do they manifest?
Well, they can disrupt the signals traveling from the brain to the muscles, leading to issues like loss of function in a limb, problems with urinary control, or maybe difficulties with spinal alignment. Cerebral palsy and spina bifida are well-known examples.
Okay. And degenerative diseases.
These, on the other hand, typically develop later and involve the progressive destruction of motor neurons, the nerve cells responsible for muscle movement. Parkinson's disease and muscular dystrophy fall into this category.
And finally, you mentioned musculoskeletal disorders, or MSDs. That sounds like a really broad category.
It is quite broad, yeah. MSDs basically cover disorders that affect the movement and capabilities of the entire musculoskeletal system. Muscles, nerves, ligaments, tendons, joints, cartilage.
So what are some common examples?
Things like carpal tunnel syndrome, affecting the wrist and hand. Tendonitis, which is inflammation of a tendon. Common strains and sprains. And problems like herniated spinal discs.
Okay, so that covers a huge range of common ailments. With all these potential issues, how do doctors actually figure out what's going on? What are the main ways they identify these orthopedic disorders?
Well, there's a whole toolkit, really. A variety of techniques are used to diagnose these conditions, and these methods help pathologists and doctors understand what's happening both on a sort of macro level, the bigger picture, and also down at the microscopic level within the tissues.
What kind of specific techniques are we talking about? Can you give some examples?
Sure. Our sources mention things like arthrography. That's where a contrast dye is injected right into a joint, which makes its structures, like cartilage or ligaments, show up much clearer on an X-ray or CT scan.
Oh, okay.
Blood tests can be really useful, looking for markers of inflammation or specific antibodies in autoimmune conditions, or even checking calcium levels. Bone scans can highlight areas of increased bone activity, which might indicate infection, fracture, or sometimes a tumor.
What about imaging?
Imaging is huge, of course. CT scans provide detailed cross-sectional images. Sometimes contrast dye is injected into the spinal fluid, that's an intraepithelial contrast CT, to get a better look at the spinal cord and nerves. Doppler ultrasonography is used to look specifically at blood flow, which can be relevant for certain injuries or conditions.
And simpler tests.
Absolutely. Simple tests of flexibility and range of motion are fundamental, just seeing how well a joint moves. And of course, standard radiographs, or X-rays, are often the first step for looking at bones. There's also X-ray absorptiometry, or DEXA scan, which specifically measures bone density, crucial for diagnosing osteoporosis.
What about soft tissues?
For soft tissues, muscles, ligaments, tendons, cartilage MRI, magnetic resonance imaging is incredibly valuable. It gives very detailed pictures without using X-rays. Muscle tests can assess strength and nerve function. And underpinning all of this is a thorough physical examination by the clinician, and various other laboratory studies might be ordered depending on what's suspected.
Right, and biopsies seem to be really critical, especially for diagnosing conditions like bone cancer.
Absolutely essential in many cases, particularly for tumors. A biopsy involves taking a small sample of the affected tissue. That sample is then sent to a pathologist who examines it very carefully under a microscope. They look at the individual cells, how they're arranged, the overall tissue structure, looking for any abnormalities that indicate disease, like cancer cells.
I see.
Sometimes they might even take an X-ray of the tissue sample itself, a specimen radiograph, which can provide additional clues.
And getting the sample.
Often, image guidance is used. This means using X-rays or CT scans in real time to guide the needle precisely to the area of concern, whether it is a suspected injury, fracture, or tumor, to ensure an accurate sample is taken.
People sometimes worry about the radiation from scans.
It's understandable, but it's worth remembering, as our sources point out, that the small amounts of radiation involved in diagnostic imaging, like X-rays and CT scans, haven't been definitively linked to causing cancer. The diagnostic benefit usually far outweighs the very small potential risk.
Okay, so imaging helps pinpoint the location and size of a potential tumor, maybe see if it's affecting surrounding structures.
Exactly.
And then a biopsy confirms exactly what type of cells are involved.
That's generally the process, yes. For suspected bone cancers or tumors, imaging helps visualize the lesion, its size, location, and extent. A fine needle aspiration, where a very thin needle is used to draw out a sample of cells, or sometimes a core needle biopsy, which takes a slightly larger sliver of tissue, can be key diagnostic steps.
And the pathologist analyzes that.
Right. They examine the sample microscopically, and crucially, the pathologist considers this alongside other information like the patient's age, which is very important in bone tumor diagnosis, and exactly where the tumor is located in the body. All these pieces help form the final diagnosis.
That makes sense. It's interesting, too, to learn that orthopedic pathology isn't just relevant to us humans. Our pets can experience many similar musculoskeletal issues, can't they?
That's absolutely right. Cats and dogs in particular are also susceptible to a whole range of orthopedic problems. It's a significant area in veterinary medicine, too.
What kinds of things do they commonly face?
Well, our sources mention common conditions like various joint problems, fractures, obviously. Sometimes older injuries can flare up again. Ruptured ligaments are quite common, especially ACL injuries in dogs. That's the anterior cruciate ligament in the knee.
Ah, yeah, you hear about that a lot in dogs.
You do. Patella dislocations, where the kneecap pops out of place, that's another one. And just like in humans, arthritis is very common, especially in older pets.
And arthritis.
Yeah.
It sounds like it's fundamentally the same process in our furry companions as it is in us.
Pretty much, yes. Arthritis, whether in pets or people, involves inflammation within the joints. It's typically due to the wearing down of the protective cartilage that cushions the bones, and often involves the breakdown of the surrounding soft tissues and changes in the joint fluid.
Which joints are most affected?
It commonly affects the major weight-bearing joints: hips, knees, shoulders, elbows. Joints that take a lot of stress over a lifetime.
What are the different kinds of arthritis that our pets can develop? Are they similar to human types?
Generally, yes. The most common type by far is osteoarthritis, which is also called degenerative joint disease, or DJD.
Okay.
This is that progressive wear and tear condition where the cartilage within the joint gradually breaks down due to ongoing friction and stress over time.
And others.
Then there's septic arthritis, or inflammatory joint disease. This usually results from an infection getting into the joint, or sometimes an inherited problem with the immune system. It leads to a buildup of inflammatory fluid and inflammation of the joint lining and cartilage.
Right.
And then there's rheumatoid arthritis, or more broadly, immune-mediated polyarthritis. This is where the pet's own immune system mistakenly attacks the joints, causing inflammation and damage to the cartilage and surrounding tissues.
So how do veterinarians typically figure out if a pet has arthritis? What do they look for?
They usually start with a thorough physical examination. They'll carefully manipulate the joints, feeling for things like crepitus.
Crepitus. We said,
It's that sort of cracking, clicking, or grinding sound or sensation you might feel or hear when the joint is moved. It suggests roughened cartilage surfaces.
ah,
They'll also feel for bones that seem rough or deformed near the joint, check for any swelling or tenderness that causes discomfort when touched, and look for muscle atrophy that's a loss of muscle mass, often in the affected limb, because the pet isn't using it as much due to pain.
and if they suspect arthritis based on the exam, are there further tests they might do to confirm or learn more?
Yes, definitely. Radiographs, x-rays are very common. Often the pet needs to be sedated or anesthetized to get really clear, well-positioned images without them moving.
Okay.
Sometimes a contrast dye might be injected into the joint before the x-ray, similar to the arthrography we mentioned for humans to help visualize the cartilage and other structures better.
Any other tests?
A force plate analysis can be used in some settings. The pet walks across a special pressure-sensitive platform, and it measures how much weight they're putting on each limb. Uneven weight distribution can indicate pain in one leg. And finally, a joint fluid aspiration or arthrocentesis might be performed. A small needle is inserted into the joint to withdraw a sample of the synovial fluid. Analyzing this fluid can help distinguish between degenerative arthritis, like osteoarthritis, and inflammatory types, like septic or immune-mediated arthritis.
That's quite thorough. This has been a really comprehensive look at orthopedic pathology itself. Maybe let's take a step back for a moment and consider orthopedics as a broader field. How does orthopedic pathology fit into that larger picture?
That's a great point. Orthopedics, as our sources define it, is the branch of medicine that specifically focuses on the diagnosis, treatment, and crucially, the prevention of diseases and injuries affecting the entire musculoskeletal system.
So bones, joints, muscles, the whole lot.
The whole lot. And orthopedic pathology provides a critical foundation for this field. It gives orthopedists that detailed understanding of what is actually happening at a cellular and tissue level when things go wrong. It informs the why behind the symptoms.
The pathology informs the clinical practice of orthopedics.
Exactly. Orthopedics as a specialty is absolutely essential for maintaining our ability to move, our capacity for physical activity, and ultimately our quality of life, really at all ages, from childhood through to later life.
And orthopedics uses a wide range of treatment approaches, doesn't it? It's not just surgery.
Absolutely not. It encompasses both non-surgical and surgical methods. And as we've sort of touched upon throughout, it addresses a huge variety of conditions.
Like what? Just to recap.
Well, bone disorders like fractures, osteoporosis, tumors, joint diseases such as various forms of arthritis, dislocations, degenerative changes, problems with muscles and tendons, tears, inflammation, weakness. Congenital deformities present from birth like scoliosis or clubfoot, traumatic injuries from accidents, degenerative conditions like osteoarthritis, and infections and inflammatory diseases affecting the system like osteomyelitis or bursitis.
So pathology helps understand all of those.
Precisely. It underpins the understanding and management of all these diverse conditions.
When an orthopedist, a clinician, is trying to determine what's going on with a patient presenting with, say, knee pain, what are the key things they'll assess?
Well, similar to what we discussed for pathology identification, the diagnostic process in clinical orthopedics usually begins with a very thorough patient history and a detailed physical examination, really listening to the patient and examining the affected area.
Imaging.
Then imaging becomes crucial. X-rays are often the first line for looking at bones, checking for fractures, alignment, arthritic changes. MRI scans are excellent for getting detailed views of soft tissues, ligaments, tendons, cartilage, muscles. CT scans can offer more detailed bone views than X-rays, or be used for complex fractures or pre-surgical planning.
Any other tests?
Blood tests can also be valuable, as we mentioned, looking for signs of inflammation, infection, or specific markers for autoimmune conditions like rheumatoid arthritis.
Okay. And the treatments themselves, you said non-surgical and surgical. Can you give some examples of each?
Sure. On the non-surgical side, treatment might involve medications, pain relievers, anti-inflammatories. Physical therapy and rehabilitation are absolutely key for many conditions, aiming to improve strength, flexibility, and function.
What else?
Orthotics, like braces, splints, or custom shoe inserts, can provide support and correct alignment issues. Injections, perhaps of corticosteroids to reduce inflammation or sometimes lubricating substances, can be administered directly into a joint or affected area. And lifestyle adjustments are often important things like weight management to reduce stress on joints, activity modification, and specific exercise programs.
And if those don't work?
Then surgical interventions might be considered. These can range from minimally invasive procedures like arthroscopy.
That's keyhole surgery.
Exactly, using small incisions and a camera to repair joint damage, to more major surgeries like fracture fixation, using plates, screws, or rods to stabilize broken bones. Joint replacement surgery, hip and knee replacements being the most common for severely arthritic joints. And various types of spinal surgery for disc problems, instability, or nerve compression.
It sounds like the recovery and rehabilitation phase after any treatment, but especially surgery, is really vital in orthopedics.
Absolutely essential. It's often said that the surgery is only part of the process. The rehab is just as important, if not more so, for the final outcome.
What does rehab typically involve?
It usually involves guided physical therapy, with exercises specifically designed to restore movement, build strength, and improve flexibility in a safe, progressive manner. Occupational therapy can also play a role, helping patients relearn how to perform everyday activities safely and effectively.
And patient involvement.
Crucial. Patient education is key, understanding their condition, how to protect the injured or repaired area, and how to prevent future injuries. And it's really important for patients to understand that recovery, especially after major surgery, can often be a lengthy process. It requires significant dedication and commitment to the rehabilitation program to achieve the best possible result.
This deep dive has truly, I think, illuminated the intricacies of orthopedic pathology and how absolutely crucial it is within the broader field of orthopedics.
Yeah.
It's really remarkable how interconnected our musculoskeletal system is, and just the sheer variety of factors that can impact its health.
It really is. And understanding the causes, the effects, the identification methods, and the available treatments for these disorders, it's just fundamental to addressing this huge spectrum of conditions that affect, well, almost everyone at some point, and as we saw, even our beloved pets.
Yeah.
The effective diagnostic techniques we have now and the ever-expanding array of treatment options, from medications and therapy right through to advanced surgical procedures, offer significant hope for improving patient outcomes and, ultimately, their quality of life.
Definitely. So, considering just how prevalent musculoskeletal disorders are right across all age groups, it really makes you wonder, doesn't it? How might future advancements, maybe in preventative medicine or perhaps earlier, more precise detection methods, how might those further revolutionize orthopedic health?
That's a great question.
Could we see even more individuals leading active, fulfilling lives for even longer, thanks to progress in this field? It's definitely a fascinating area to contemplate.
Food for thought, absolutely.
And perhaps something for you, the listener, to explore further if any of the specific conditions or topics we've discussed today particularly resonated. Thanks for joining us for this deep dive.